lining the back of the eye is the retina, which is the nerve tissue at the back of the eye. And the main vessels that drain blood out of the retina and out of the eye are known as the retinal veins. Sometimes these veins can be blocked, and that is what we call a retinal vein occlusion. It's very similar to having a stroke inside the eye. Retinal vein occlusion can cause blurring of vision or distortion when lines don't look straight anymore. Anybody can get a retinal vein occlusion, but it's much more common in older patients, particularly over the age of 50. The main risk factors for retinal vein occlusions include high blood pressure, diabetes, high cholesterol, and smoking. But some patients are unlucky and can still get retinal vein occlusions without these risk factors. Treatment of retinal vein occlusion is twofold. Firstly, we require to treat the underlying cause, and secondly, we need to treat the actual eye. So treating the underlying cause is usually in conjunction with your general practitioner, and that includes managing things like your blood pressure, diabetes, cholesterol, and smoking. So it's very important to stop smoking if you are currently smoking. Treatment of the eye depends upon whether there is swelling at the back of the eye causing blurred vision. This is known as macular edema. If macular edema is present, then treatment is usually required, and the most common treatment are medications that are given as an injection into the eye. These medications are known as anti-VEGF or VEGF medications. Occasionally, steroids can also be injected into the eye. It's important to note that these medications need to be given on a regular basis to work. So normally this is given monthly, but sometimes if patients respond very well, the interval at which injections are given can be stretched out to 2 monthly or even longer. About 50% of patients, or half of patients, will be able to come off injections after about 2 years of time, and the other half will need to continue ongoing treatment indefinitely. Although these injections sound very scary at first, we do numb the eye beforehand, so rest assured this is not a painful procedure, and most patients feel much more relaxed after having their first treatment. Apart from these medications which are given into the eye, sometimes we need to supplement management with either laser or even surgery.